Good afternoon, everybody. My name is Frank Puglisi. I am a clinical pharmacist from Vitas Hospice. I'm also the lucky husband of Jamie Puglisi, who's an AIH patient. I'm going to talk about CBD and medical marijuana here today. It's a subject that in the pharmacy world is still not studied that well. But there is some information out there and certainly case reports from patients to support its use. All right, so some objectives today. We're going to review THC and CBD pharmacology, indications for use in AIH, clinical literature, or specifically Craig's survey, and some drug interactions. We're going to review CBD oil compared to hemp oil, and then we're going to go over state laws and potentially if anyone was going to attempt to order online. Okay, so this first slide here is a visual of all of the endocannabinoids receptors in the human body. There's a CB1 receptor and a CB2 receptor. You can see throughout the body, many of the organ systems do have this system involved. Some pharmacology. THC, which is also known as delta-9 tetracannabidiol, is the primary psychoactive component in cannabis. THC activates both the CB1 and CB2 receptor. It has effects on pain, appetite, digestion, and thought processes. Some of the symptoms and disease states that THC could be useful in: post-traumatic stress disorder, depression, nausea, spasticity, anxiety, and insomnia. Smoked, vaped, or ingested THC will have acute effects to potentially treat some of these symptoms. One thing I did want to bring up as a precaution, THC and CBD may lower circulating thyroid hormones. So if you're someone with either hypo or hyperthyroidism, please check with your physician before you initiate such therapy. All right, so CBD, in contrast to THC, has little affinity to actually bind to these receptors. CBD can actually negate THC's ability to induce psychoactive effects. So what does that mean simply is that CBD oil can negate some of the, quote, high associated with THC. I know that's a concern for many patients. They don't want to experience the high related to cannabis, and this is where the THC and CBD ratio comes into play. We'll discuss that a little bit later. CBD specifically can produce pain-relieving, anti-anxiety, and antipsychotic-like effects. CBD is also a very potent anticonvulsant. The drug Epidiolex, which is specifically a synthesized cannabidiol molecule, was FDA approved in 2018 to treat 2 rare seizure disorders in children. CBD is a known neuroprotectant. It can be anti-inflammatory against both acute and chronic autoimmune-induced inflammation, obviously of interest here. Unlike THC, CBD in most cases will not target symptoms acutely. The best comparison I can use is antidepressant medications. You've got to give it 3 to 4 weeks to kick in continued use, so please be patient. There is a newfound syndrome called clinical endocannabinoid deficiency. I bring this up because there are endogenous cannabinoids in the human body, as discussed earlier with the receptors, and this deficiency in the endogenous cannabinoids may play a role in diseases such as fibromyalgia, irritable bowel syndrome, and autoimmune disease. All right, so some potential uses here related to AIH specifically. Potential symptoms that we might be able to alleviate include nausea, vomiting, insomnia, fatigue, anxiety, and what some patients report as liver inflammation. I don't really have any good data to support that or why that happens or what that means as far as hepatic inflammation, but one thing with medication, if the patient feels it's working, it's working. All right, so use of cannabidiol and autoimmune hepatitis. What are the patients doing? Dr. Lammert's group here at Indiana University performed a cross-sectional survey study using the AIH social media communities via Facebook. In total, there was 93 autoimmune hepatitis patients that reported using CBD oil for symptom management. Reported symptoms consisted of poor sleep, pain, fatigue, and again, what the patients deemed as liver inflammation. The survey showed statistically significant symptom improvement in each of the aforementioned symptoms. Additionally, only 3 out of 93 patients reported severe side effects. These included hunger, dry mouth, red eyes, itchiness, and euphoria. I'm not sure about you all, but if euphoria is a severe side effect, the drug's pretty tolerable. All right. Drug interactions associated with CBD. Both THC and CBD have the potential to increase bleeding risk in patients using aspirin, medications such as naproxen, ibuprofen, or blood thinners like warfarin. It is believed THC and CBD can affect the same enzyme pathways where common anti-inflammatory drugs work. I've listed some of the specific enzymes and medications that could affect or be affected using THC or CBD, but what's most important to this group is the potential interactions of oral corticosteroids, oral budesonide, and possibly modafinil, which is a medication used for AIH-induced fatigue. Not sure if anyone here is on that. All right, the THC-CBD ratio. In December 2018, Congress agreed to the final version of the Agricultural Improvement Act of 2018, also known as the 2018 Farm Bill. For the purpose of our discussion here, we are focused on a very small portion of this act. Hemp is defined in the legislation as cannabis plant with one key difference than cannabis, and that is the hemp can only contain 0.3% of THC. I'll get to more of that. For decades, federal law did not differentiate between the hemp and the cannabis plant, all of which were effectively made illegal in 1937 by the Marijuana Tax Act, and then formally illegal in 1970 by the Controlled Substances Act. All right, so this slide here gives a visual in comparing hemp oil to CBD oil and concentrations of THC to CBD in different strains of marijuana. Disclosure, I don't work in a medical dispensary. I don't know all the strains of medical marijuana. The focus here was more about the potential utilization of CBD oil and how it can benefit you. But I want to go through and make everyone understand the difference here, the origin, so we can better understand what we're buying online or going to a dispensary. Hemp oil, also known as hemp seed oil, is the most commonly derived form of industrial hemp. It's cultivated. Industrial hemp plants are significantly lower in THC than normally occurring cannabinoid plants because the industrial hemp is bred to produce fewer flower buds, which contain the majority of the THC cannabinoids. So the hemp oil is a lesser form of the pure cannabis plant, and extracting that oil is going to give you a very low concentration of THC, and that's the THC based on different laws through the states that you're going to be able to order online, or if you have a medical marijuana card, then be able to get the actual cannabis oil. The cannabis oil is created by extracting oil from the leaves of the cannabis plant, particularly cannabis indica. For this reason, cannabis oil, which you might see advertised as THC oil, faces tighter restrictions, as I mentioned, and is illegal in many countries and in most states in the United States. All right. So this next slide here, before we get into the specific laws, every drug is either a medicine or a poison. What determines that is the dose, the administration, and the formulation. And some examples I want to bring up with that. Schedule 1 is the classification by the DEA for illegal substances that do not have medicinal purpose. Drugs in this class are marijuana, which is somewhat backwards based on some of the state laws. Heroin, which is an excellent cough suppressant. Ecstasy, which can be used, this is serious, ecstasy might be approved in the next few years for post-traumatic stress disorder. LSD has been known to cure migraine and cluster headaches. Cocaine is in every hospital pharmacy and used daily for nasal surgeries. And methamphetamine is used daily for children with ADHD. The reason I bring this up, and my point, is there's a preconceived notion of all drugs. I say methamphetamine, I say cocaine, everyone gives me a weird look. Same thing with cannabis. Don't let public perception get in the way of you trying something that could benefit you for a specific symptom. That's the take-home message here. There we go. So as far as the law, being that marijuana is still Schedule I by the DEA, regardless of your state's laws, technically the government, the federal government, could still prosecute anyone in possession of THC. The DEA has turned a blind eye to this, per a lot of the state laws that have legalized it medicinally and recreationally. The next few slides, and they'll be available on the app, go through each individual state. I'm not going to do that in the presentation, but you can evaluate what your state has listed. I believe this is the most up-to-date data. I did my best with that, but please check your state's .gov website to make sure what I have listed here in these next few slides is accurate before you start ordering it online or trying to go to a dispensary. All right. Oh, let's go back one here. All right, so buying CBD oil online. Disclaimer here, I have no affiliation whatsoever with these websites or these vendors. I've never purchased anything from these websites. I have a colleague who's also a clinical pharmacist who actually works in a medicinal dispensary who was kind enough to share some valuable information. This, in his opinion, are the best online sites to order CBD oil. Everything, again, shipped online is supposed to have less than 0.3% THC. Medicinal dispensaries will generally have a CBD dominant product, 4-to-1 ratio, 10-to-1 ratio, that's CBD to THC. Again, trying to optimize anti-inflammatory effects of CBD without getting some of the psychoactive effects of THC. Everyone will respond different. Someone on a 4-to-1 might still have some psychoactive effects from THC. Others, all the way up to a 10-to-1, still may have some effects. So again, do your research, find out what works best for you in relation to state laws as well. Overall, in the research I found with CBD and THC ratios is there's some type of synergy with the two. And the higher ratio you go, the more CBD, the less THC, the less positive symptom outcomes patients report. So again, take that with a grain of salt. I don't have much clinical data at all in my research related to CBD oil or related to these ratios. With that, I'll try to answer as many questions as I can. So hit me. Okay. Mm-hmm. Yes, you will. Now, there's also different levels depending on what they test for, if it's urine, if it's hair. Cannabidiol and tetrahydrocannabis are both fat soluble, which means they stay in your system a lot longer than water soluble drugs. In your hair, it could be anywhere from 90 to 120 days. In your urine, if continued use, could be anywhere from 25 to 35 days. Yeah, good question. Anything else? Yeah. Again, that would be, I can't answer that question. I would assume if we had, you're saying if you ordered it online and tested positive? So again, so they're testing, so let me go back on what I said there. So if we order hemp oil, which is less than 0.3% THC, I can't imagine you would test positive. Depending on the ratio of CBD to THC, yes, you may. If your question is, if you're taking straight CBD oil, which I don't believe there's such a thing without some THC, technically, no, you would not test positive, if that clears that up. Okay, so they're testing for THC, they're not testing for cannabidiol. But again, every product has some THC in it. If it doesn't, it's not a good product. I'm just being honest. Yeah, yeah. Yes?
Since it is illegal per DEA, it probably doesn't go through any of the FDA regulatory stuff.
It goes through, no, it's not FDA approved. That's exactly right. So, again, I'm very reluctant to go into specifics because I can say, all right, we have this 4-to-1 ratio, 2 milligrams of THC to 8 milligrams of cannabidiol. I don't know that that's in there. As a pharmacist, I'm very reluctant to say, one way or another if that's the best way to go because I don't know what's in it. That being said, going the other way, don't be afraid to try things for symptoms that are otherwise not being controlled. That's the take-home message.
What is the interaction with the prednisone?
Yeah, so prednisone and other oral corticosteroids go through what's called the cytochrome P450 enzyme system in the liver. And prednisone, dexamethasone, methylprednisolone are substrates, meaning this enzyme is called 3A4, metabolizes those steroids. Marijuana, THC, CBD, also go through the same pathway, so the enzyme competes for the two. So if the prednisone has a little bit more than the CBD, you're going to get more CBD THC levels, or if the THC grabs more of the enzyme, you could be not metabolizing your steroid and then inducing steroid side effects. Anyone else? Yep. Yeah, no, I mean, I don't have much, just case reports that I found that people using CBD oil reported lower circulating thyroid hormones, T4. And what does that mean? I don't know. I mean, obviously, if you're hypothyroid, it might mean you have to adjust your dose, or if you're hyperthyroid, adjust, I believe Tapazole is the only drug they use anymore for that. So it's just a matter of be cautious if you have some type of pre-existing thyroid disorder. There's not any good literature. It's just case reports of people saying, hey, my thyroids went down because I started this. Yeah. Anybody else?
You were saying that the CBD oils, they don't work like this?
Yeah, so CBD oil, so, for instance, if you were to use a vape of THC and you're nauseous, you do the vape, 10, 15 minutes later, it may or may not treat the symptom. Whereas CBD oil, if you're using it for chronic pain, just overall systemic inflammation, you're not going to take 2 drops and then 20 minutes later the pain's relieved. Or taking a pain medication, whether it's an anti-inflammatory, an opiate, it doesn't work in that manner. It works more like an antidepressant, which in the same token, you don't take an antidepressant, you feel better a day later, right? So it's a buildup in the system. Again, activating our cannabinoid system is believed to be why it's a slow process. So you've never received it before, so your body's not used to it. So it's got to build that tolerance up and build the receptors up to receive the medication. Yeah. Anybody else? Did I go over?
On one of your charts there, you showed the indica
Mm-hmm.
versus the sativa,
Yep.
and it looked like the sativa would have a better effect with the high CBD than the
That's a fair extrapolation, but that's not necessarily the case. Yeah. I understand your question, and that does make sense based on higher CBD, but again, that's not necessarily what's seen in treatment. Indica might work better for someone than sativa, is the point. Depends on the person. Anything else?
Are you seeing more interest in research in this?
Yeah, I mean, that's what I was talking with Craig is, it pains me to do this presentation without any solid data. It does. That's not what I like to do, but I wanted to present as much information to everyone here as possible, try to educate them, alleviate their fears of trying new things. But until a drug company has a reason to spend a lot of money on it, it's tougher to get these studies funded.
Is there anywhere that's really looking into it, a particular area?
Not, you mean as far as symptom management?
No, as far as the CBD oil, or is there anyone who's got any interest in it?
I
Pursuing it?
Yeah, I mean, I researched hard before this to try to find some type of grab data. It's just not there, no, no. Yes?
Well, we spend about 6 months a year in California. Of course, this is all legal in California. I know it's not federal, but it is.
Well, like I said, it's confusing, I know, it is.
And I don't have any experience myself, but friends tell me.
Sure. There'll be samples in the back.
Friends tell me that you can just walk into a dispensary and they'll help you. They'll say, you say, I've got back pain, and they'll say, try this. And I don't know what the research is behind that, but honestly, everybody is going to these places in California, and I have not. Sure.
Any other questions? Yeah.
Well, I know that Canada is legal, and my girlfriend is taking it for a back injury,
Mm-hmm.
and
What is she using?
she's using the oil.
The oil, okay.
Okay, so, but the only problem with that is, we can't travel, like, she travels in Canada, so you're fine. You can't travel to the States, because even if we went on a cruise, they say you have it. Now, I don't know if you have a prescription, but she went to one of those clinics, had to talk to a person that asked questions, then she talked to a doctor, then she had to get a script for it, and she had to send it in the mail for it. But she didn't have a prescription for it.
Again, I don't want to comment, I didn't read up on Canada law, so,
No. Okay, but then in Canada, because I have kids, so, but they don't use oil, they use.
I understand, sure. See, again, just say it, that's part of the stigma, everyone is still even nervous saying it. We can vape it, we can ingest it, we can smoke it.
She had to talk to the doctor to get a script, it wasn't, and then when it ran out,
It depends on the state. So in some,
Yeah,
in Canada, okay,
you have to get a script, I know where we go.
yeah. Yeah, so here it depends on the state whether they legalize recreational, medicinal, or both. So like California's both, Colorado's both.
Right.
Pennsylvania, where we live, is only medicinal and it's only for 17 diagnoses. You have to fall within one and have documentation of one of those diagnoses to even get your card to be able to walk into a dispensary.
They did just do a
yeah, of course.
in Minnesota. That's true, different states have different laws, but TSA, airport-wise, you cannot federally bring
That's correct.
medical marijuana
That's right,
through TSA.
right.
You
You can't cross state
go
lines.
do CBD.
If it's less than 0.3%. Right. Okay. Okay, give me, what's your question?
Tell me what that would be in like milligrams. Are we talking like?
Well, it depends what the ratio is. There might be a 4-to-1 ratio where there's 2 milligrams of THC and 8 milligrams of cannabidiol. That's not, if we're, depending on what volume it is, that's how you know the percentages. So if we had 2 milligrams of THC in 100 milliliters, you know, that's what it's related to, yes. What was your question?
To clarify, because all my research prior to coming here, I've been trying to figure out the difference between the hemp oil
Right.
and the CBD oil. Everything I have seen online says that hemp oil doesn't have medicinal effects, that it's the good fats, it's good vitamins, but
Right.
not.
That's a good selling technique by the company you're reading it from. Yes. So basically, again, let's break it down like this simplistically. Hemp-derived CBD oil has to contain less than 0.3% of THC. Cannabis-derived CBD oil can have, depending on the ratio, no specific amount of THC. Now, it'll be specific in the bottle, what they label it as, but that's why the hemp is allowed to be sold online, and in certain states, it's the only thing allowed, is that less than 0.3%. Again, preventing the chance of psychoactive effects.
Couldn't these companies just put whatever they want on labels?
Listen, they can do whatever they want. That's why I tried to list some reputable, yeah. Be very careful about buying online. It might be olive oil you're buying online. Exactly.